Hi everybody, welcome to our Facebook Live and happy Veterans Day. I am super excited again to be joined by Dr. Eric Bush, the Chief Medical Officer here at Hospice of the Chesapeake. And we're going to talk today about some of the unique needs for veterans with serious illness and end-of-life care. So thank you, Dr. Bush, for being here.
Thank you.
So first of all, you personally have a unique perspective because you're a veteran yourself. So thank you for your service. If you want to share a little bit about your own.
Sure. So thanks to all the veterans out there. I was in the Army Reserve from 1988 to 1994.
Okay.
Signed up initially as a combat medic and was able to become a licensed practical nurse by the time I was done with my commitment.
Okay.
Correct.
Excellent.
Yeah.
Excellent. Thank you.
Thank you.
So that gives you sort of, a deeper insight, I would think, into the experience that veterans have, at end of life.
Absolutely. Not just at end of life, even those, again, in the palliative setting, so those that want to focus more on quality of life. It's definitely, veterans have unique needs. They're unique, just like all the other populations we serve, they have unique needs, interests, things that really bond them together. So veterans, ultimately do this because they want to be part of something bigger, give something more than themselves.
That's sort of the motivator, the guide.
Exactly. So it's a very altruistic motive, and if you think about it, while the commitments, the sacrifices may be different, it's fairly similar to those that go into healthcare in general with regards to, again, wanting to serve, wanting to be part of something bigger, and giving of yourself and sacrificing.
Okay. I forgot to mention, if anyone's interested in joining our conversation, we welcome your comments, questions, while we talk about sort of some of the unique needs that folks who are needing palliative care as well as end-of-life care who are veterans have. So let's talk about that a little bit. Tell me, what do you see some of the things most frequently, I guess, that you experience with veterans?
So first, I think just a little bit of background. Not everybody is a soldier per se. There's all different branches of the military,
right?
And I think that's the first thing to recognize. And everybody has a job or an MOS or military occupational specialty, and so not everybody, like yours truly here, went in as a medic and not necessarily infantry or combat engineer.
Okay. So the role that they played in the military affects their overall experience.
Exactly, their overall experience. There's always a chain of command, and military people in general, do well with that structure, respond to that structure, and expect that structure. And sometimes when they get out of the military, it's difficult to adjust to society where there's not that same rank and file, so to speak, that same infrastructure with regards to chain of command.
Okay. So those sort of, and that translates back later in life or when they're needing healthcare services? Okay.
Correct.
Okay.
And so healthcare, some of the needs of veterans are what you would expect. So for example, musculoskeletal injuries, those things are not surprising. But then along those lines, there are some other things that, people may be surprised about, such as chemical or environmental exposures. And those chemical exposures can definitely vary depending on the generation veteran that you are.
Okay.
So for example, Gulf War era veterans, Operation Iraqi Freedom, Operation Enduring Freedom, a lot of times there are more petroleum exposures versus Vietnam era veterans that have had exposures to things such as Agent Orange, per se.
So those actual chemical, the war era that they experience, they're going to have a different chemical, physical reaction based on what type of war they were in.
Exactly.
Okay, all right.
And environment also plays a role, not only just with chemical exposures, but if you think about the environmental exposures. So again, Gulf War era veterans, a lot of times the heat, at risk of things like heat stroke, versus say Korean era veterans who unfortunately were exposed a lot to frostbite. And so we know that those areas that were frostbitten and they have scar tissue, there's actually higher risk for skin cancers.
Wow.
Yeah.
All right, so in addition to their service that they did, the rank and file and the type of service, the type of war that they were in also plays a factor. So
Correct.
both of those pieces impact the type of healthcare that they're going to need later on.
Right.
What about emotionally? So
Sure.
just I'm thinking for war era, World War II veteran had a totally different emotional experience than a Vietnam veteran, even coming back in.
Correct.
So that's got to play, I would think.
Correct. It definitely plays a role, and a lot of those older era veterans, that's something they just didn't want to talk about. It's as well as some of the newer era veterans, and that's okay to not want to, but there is a higher degree of behavioral health, mental health challenges, whether it meets full criteria for PTSD or depression, substance use disorder, also, homelessness. Unfortunately, on any given day, there's about 5,000 veterans that are homeless, which is really, a shame. That shouldn't be happening in this country.
And that's really hard.
Yeah.
The care that you and hospice teams provide to individuals who are veterans, can you talk to me a little bit about
Sure.
that? Like how is that different? So we've talked a little bit about you've got this awareness
Right.
of their life experiences, and I would think you've educated the team going in that
Sure.
these are some of the things that you need to be aware of. Is there anything specific with the type of care that differentiates care to a veteran?
Yeah, so again, I really think our philosophy with regards to holistic care, and it starts again in the palliative setting. So I have a patient who I've been seeing now for about 6 years. He's 2 months younger than me, so there's a lot of bonding that's gone on there, just from a age or generational perspective. He is also a Gulf War era veteran. He's a Navy veteran, and so a lot of times he has had some depression, as well as some PTSD, as well as some physical pain, because he has non-small cell lung cancer.
Okay.
And over the 6 years that we've come to know each other, sometimes we talk about physical things, sometimes we don't talk about that as much, and really just let him guide the conversation and see where things are for him, again with focus on quality of life, and some of the things that we've come to decide with regards to treating his pain at this point really without opiates. He was on opiates for some time, and looking at alternative ways to try to treat his pain and just be as holistic as possible. He also has some other manifestation that other vets have, such as tinnitus or ringing in the ears, which is something else a lot of other vets get exposed to. So there's a lot of moving parts, but I think as long as you keep an open mind and let the patient drive the conversation in that visit, that's really how you develop a relationship that's hopefully therapeutic for the patient. He has a special needs child who's an adult, which also presents its own set of challenges. So I really just let him make the call and decide what we're going to focus on, whether it's more medical, psychosocial, behavioral health that day, because depending on which day and time I see him and what's troubling him, that's going to determine what the plan of care is going to be.
Going that
Absolutely.
direction.
Absolutely.
Got it. So you mentioned a little bit that this person and patient had a family child.
Correct.
I'm guessing too, how does the family interact with the veteran and their care? That's probably got to play in as well.
So that's another important piece, is really, families are along for the whole ride, obviously, and those veterans who have made the ultimate sacrifice with their lives, obviously the families are the ones that are left behind, and so they need a lot of special attention too, because they really are part of that whole unit in making that sacrifice. It's not just the veteran per se, he or she, it's also the whole family unit that really
that
ends up making
dynamic
that.
changes
Exactly.
because of the veteran's experience. Then the family
Right.
dynamic kind of shifts and has to evolve.
Correct.
Is there much education that you do when you're dealing with a veteran who is receiving palliative care and or end of life hospice care? Do you kind of help the family sort of, understand some of the awareness that we've talked a little bit about? Do you kind of educate the family as well?
There is, even just from general accessibility of care. I'm sure everybody's well aware, some of the challenges the VA had several years ago. While that has improved to some extent, I encourage veterans that if they feel that there is something that they feel is an urgent health need, to seek out medical care in the community, if it's accessible to them, that these are, things that can't wait per se. So a lot of education with regards to that. Also
Sort of advocating for their not to be,
exactly advocating for their needs.
Yep.
Their families, and again, needs, whether it's medical, behavioral health, what have you, really advocating for that, to seek care. Also, service connectedness.
Okay.
So we know that there's certain, disorders or medical conditions that carry with them a degree of service connectedness that can then get the veteran and his or her family certain benefits,
Okay.
in addition to the health care benefits.
Okay. Wow, that's a lot to
There is a lot,
to take in.
Yeah.
So, and it definitely seems like having the experience of serving our country really kind of impacts
Sure.
not just that time that you
Right.
did that, but
Right.
continuing through your life.
Right. It just broadens your horizons and it lets you see things through somebody else's lens, and I find that very helpful.
Yeah, absolutely, absolutely. So I'd like to talk a little bit, and if you're just joining us, I'm with Dr. Eric Bush. He's our Chief Medical Officer here at Hospice of the Chesapeake, and we're talking today, Veterans Day, Happy Veterans Day,
Happy Veterans Day.
about some of the unique health needs and challenges that veterans experience. So I'd like to talk a little bit about Hospice of the Chesapeake and a program
Sure.
that we have that's We Honor Veterans. And if you want to
Sure.
speak a little bit
Sure.
about that, because I think it's a unique thing that we have. to offer.
Absolutely. So We Honor Veterans is a program that is fairly ubiquitous throughout hospice, but we've really put our own niche, our own finishing touch on it, and really tried to highly personalize that experience. And so what we do on any given day, especially given the areas that we serve in Anne Arundel and Prince George's County, we typically have 100+ veterans that we care for just in the hospice setting.
Okay.
So even more when you talk about our palliative care program.
Okay.
And what we do is we try to match veterans to their needs. So veterans from that same era, veterans that have had similar experiences, whether it's combat or not, or what have you, and really try to personalize that so the veteran, our veteran volunteer for the We Honor Veterans program, can really truly meet that patient and family where they're at, and so try to make it as much of a match as possible. In addition, we have had 5 years straight of our Welcome Home Vietnam Veterans, which is a highly successful program. And it is great to see just everybody participate in that.
Mm-hmm.
We also have our honor salutes, which is really
Talk to me a little bit about that.
sure. So the honor salute is done in conjunction with the U.S. Naval Academy.
Okay.
A lot of times the midshipmen will come and do a final salute for those, regardless of whatever branch. Doesn't necessarily need to be someone who's in Navy, but Army, Marines, Air Force, Navy, what have you, whatever branch of service, Coast Guard, whatever branch they served in, we'll do a salute for, and it's arranged, coordinated with the family,
Okay.
so the family
So
can
it's
be
a
there.
personal, it's a very
It is a personalized touch
Okay.
to thank those that have given so much to our country for one final time. And they also, patients and families receive a certificate.
Okay.
They also receive an embroidered quilt, which is made by some of the volunteers in the area, is really, as well as a pin. It is a beautiful experience, and our way at Hospice at Chesapeake and Chesapeake Palliative Medicine to thank those veterans for their service to our country, to our community. And we're very proud of the fact that we are one of only 11 programs in the country to have achieved what's considered level 5, which is something we need to renew annually. And we provide a lot of education to our internal as well as to our internal staff, as well as the communities we serve regarding these programs.
That's excellent. That's gotta be a great experience. I know we also do group honor salutes, and I've been able to witness one of those, and it's just amazing to see the response from people when singing their song from their from what they remember, and like their faces lighting up, and it's such an emotionally moving
it's really
experience,
touching.
and
very moving.
Yeah, and a great way to honor and respect the service that these men and women have provided. So thank you so much for your time this morning.
Thank you.
We appreciate you guys watching, and we'll be back next Monday morning at 9 a.m. to talk a little bit more about palliative care. Thanks again for watching.
Great, thank you.